people have been on lockdown, they've been remote working, doing all this stuff. So you've seen kind of a whole new list of symptoms and injuries. You want to share with the listeners what you've been seeing out there?
More now than ever, low back pain, and specifically people having disc bulges and disc herniations and pinched nerves, and the radiating of pins and needles down the leg. I mean, it is overwhelmingly prevalent, and that's people are sitting on their couches. This week alone, Jim, I had somebody walk in and tell me they've been on their couch since March, working 40 hours a week.
Hey, what's up, everybody, and welcome to Shit Trainers Say, a regular podcast brought to you by the trainers of Catalyst Personal Training in University City. And these are usually conversations that we have with our clients. Here recently, it's been conversations with related professionals in the fitness field. And today I have my good friend, Dr. Brendan Donahue with Donahue Chiropractic. We have a good relationship with him. We send a lot of people that their injuries fall outside of our scope of practice. We send them to Dr. Donahue. We communicate back and forth and coordinate training programs and coordinate with Dr. Donahue so that we can get our clients better and moving better. So, Doc, welcome to the show.
Thanks for having me, man.
Yeah, thanks for coming on. And
I
always
love the title, by the way. Who came up with that?
I did. You know, and I put out a survey because I thought, well, maybe it might be a little bit too offensive, but I put out a survey and it was overwhelming to keep the name. So we kept the name.
Yep. Love it.
And because it resonates. But so here we are, we're deep into COVID, right? It is November 2020, a year that is like a dog year. It's like 7 years long this year. So I know people have been on lockdown, they've been remote working, doing all this stuff. So you've seen kind of a whole new list of symptoms and injuries. You want to share with the listeners what you've been seeing out there?
More now than ever, low back pain, and specifically people having disc bulges and disc herniations and pinched nerves, and the radiating of pins and needles down the leg. I mean, it is overwhelmingly prevalent, and that's people are sitting on their couches. This week alone, Jim, I had somebody walk in and tell me they've been on their couch since March, working 40 hours a week. I said, how's your couch not worn out? I don't even know. I don't understand that
Got
one.
an indentation.
Right.
Yeah.
So it's that, and then headaches are going way up. I think that some of it's just stress related, right? It's been a tough year on people's psyches.
Right.
And there's a direct correlation between psychological and actual physical pain.
Mm-hmm.
And this one surprised a lot of people, is youth sports injuries.
Oh, really? Oh, because they hadn't been doing anything, and all of a sudden they go from 0 to 100.
That's right.
That makes sense.
Yep.
Okay.
They picked up.
Same like adult injuries in the spring.
It happened. It
Yeah.
happened, right?
Mm-hmm.
And I think some people were expecting that one.
Uh-huh.
I think adults just thought that the kids playing the video games could all of a sudden pick up playing soccer 4 hours a week.
Uh-huh.
And unfortunately, that's not how it works.
Right. Yeah, your body has to adapt.
They weren't doing PE.
Yeah.
They weren't doing just recess. These little things where they're moving about.
Yeah. Out playing with their friends.
Yeah. So those are kind of the three main things that I've seen this year that came about.
Okay. All right.
Some of them, we use the word, you probably use it too, is tissue tolerance, right? When we're at home and gyms weren't open,
mm-hmm.
our tolerance went down.
Yeah.
And you start working out, you start moving again,
mm-hmm.
and some people try to pick up where they left off,
mm-hmm.
and that's an unfortunate situation. It's
right.
Train on a nonstop right there
right.
for an accident. But I found the ones where they were working one-on-one with the trainer were less likely to get injured.
Yeah, because they can modify, do some regressions and things like that.
Right.
And before I pose this next question, I just want to do a disclaimer. This is our wonderful trainer, Grace, back here. Wave to everybody, Grace. And just to prove to you, this is a working gym. We close down during the day to clean, disinfect, all that stuff. But she's here getting ready for some clients coming in. So that's Grace. Just so you know, we are a working gym. And then the one thing that I wanted to talk to you about, so those are the increases of injuries. So when you talk about low back pain, what are some things other than going to you? What are some things that people can do to prevent that or improve it?
Without getting too sciencey here, one of the most common causes of low back pain is simply a rounded low back. All right, so we switched our desk chairs, might not be as ergonomically friendly as the expensive one your employer bought you. We might be sitting on the couch. We might be having our rear end on a bar stool, half on it, half off, and we're bending forward on the bar while we're working, right? So a simple thing of putting a pillow behind our back, or pushing your butt all the way against your chair and sitting up nice and tall.
Okay.
That alone right there has taken care of a lot of the new related back pain.
That makes sense because the way the discs work is that they're in between the vertebrae.
Correct.
So if you're a rounded low back, it's constantly pushing that disc out the back, pressing on the nerve, right?
Right.
Yeah.
It's like Jello, and I say the middle's Jello, the outside's rubber bands. And when we sit flex, the outside rubber bands start breaking and the gel starts squirting out.
Right. And pressing on the nerve, and that's when you get the pain and the radiating down the leg and everything. So other than not sitting, let's say they full-blown low back pain, right? And then they come to you. What are you doing for them? What are you prescribing for them? All of that good stuff.
Yeah. It gets a little hard to, we're going to be vague here, right?
Okay.
And I want to put a little disclaimer is that, we got to be careful on giving prescription in this type of setting. But I think the last study I read, 90% of the back pain, the disc goes backwards, right? And so for rounding, what's the opposite of rounding? Full extension,
right?
So I tell people, get down on the ground, throw some pillows under your chest, lay in an extended position.
Yeah.
If it's a hot low back, that person who is like stuck and crippled, get on your back, put your feet up on your kitchen chair, and just lay there. Put a pillow under your head and lay there until things calm down.
Yeah.
It's kind of our safety position.
Ice help?
Ice is usually better than heat.
Okay, got it. Okay, because you're looking at reducing the inflammation.
Correct.
Got it. Okay.
So, the extension position. A lot of people are familiar with like a cobra pose in yoga, right?
Yeah.
Just go hang out in that position, maybe do a few reps. And I tell people, if symptoms get worse down the leg, you better stop. Stop right there.
Yeah.
If anything's referring more, we have an issue on our hands here.
Okay.
So,
And then, so that's something they have to do on a regular basis and consistently, right? In order to stay out of pain.
Yep.
What else can they do?
Got to get moving as soon as we can.
Okay.
Exercise and motion is one of the best things we can do. And people are like, should I walk? Yes. They said walking is one of the best things for low back pain. And I think walking is one of the most underutilized forms of exercise. You want me to go walk for a half an hour? You betcha. Go on out the door, bundle up. It's starting to get cold. I don't care. Put some gloves on and go walk.
Yeah. Yeah. That's the most curious thing to me because I've been lifting most of my life, and I have periodic low back pain, as you know, because I come to you. Whenever I get up and walk, sometimes even when I go play hockey, it feels better. Why is that?
Recycling of tissue. All right.
Okay.
And so a lot of people can relate to this. They're sore first thing in the morning and then get up and get moving. Right.
Yeah.
When we lay still, everything becomes stagnant, especially with low back. Right. All the fluid inside the disc and around the disc just lays there all night. And then we get up and we start moving, and it's slow to regenerate. That process gets slower and slower as we get older, and that's why back pain gets worse.
So as we move and circulate the blood and all the other fluids, it's like I say blood is like your body's oil, and you need to get it moving and circulating because it delivers oxygen, nutrients, everything in the tissue needs to be healthy, but also takes out the trash, right?
Yes, it does.
Yeah, so that whole system needs to be working.
Yep.
Yeah.
I think also the motion is lotion, right? We kind of use that phrase, and that refers back to what you just said. It's, we just got to get things moving, and especially if anybody has arthritis.
Yeah.
Right? Or it's a catch-22. We get arthritis. We kind of feel doomed. It's like, oh, man, we have what? But then it's the pain that keeps us still because we have arthritis. You see how that plays out?
Yeah.
The only thing that gets us past arthritis is motion. And so it's that first little bit when we have a really bad arthritic joint, got to get moving.
Yeah.
You know,
So it's damned if you do, damned if you don't. You're gonna hurt if you're gonna hurt more if you don't move.
That's right.
But you're gonna hurt if you move.
Right.
But you're just gonna hurt less.
Right.
Got it.
But that's why, you know, make sure we're consulting with our medical providers before we just get moving. Right?
Yeah,
Let's make sure everything else is sound.
Okay.
Let's make sure that is the source of pain before we just jump into assumptions.
Gotcha. Okay. And I like that because I think I say it all the time. Getting old isn't for wimps, right? I mean, because like you get these. I can't tell you the number of mornings I woke up and my ankle hurts. I haven't done anything to my ankle, but it just hurts. And it'll hurt all day.
Yep.
And then I think I got some kind of gremlins living in my place. But then I go to bed the next night, wake up in the morning, and then my ankle's fine. You know, but I'm a big believer in movement. And so I try to move through or work through, because me as a trainer and as a fitness professional, a lot of times when I get clients, they come to me and they say, oh, I got this going on. And so their natural tendency is to, treat it. Let's put the police tape around it.
Yeah.
Don't go in there. It's a crime scene. Don't contaminate it, whatever you want to call it. And my philosophy is, well, let's go after it. Let's address it, you know, but do it in a correct way, because I know that you have to, one, create the movement, right? In order to restore full range of movement, you got to create movement, right? And then you got to strengthen the muscles, tissues, everything around that so that it gets better long term. What's your philosophy on that?
Same exact thing, right?
Okay.
We got to get things moving. I often have that same scenario where, oh, I had an MRI. I know I have a disc bulge. I don't want you touching my back. It's like, where did that philosophy come from? Why are we saying that? You know, just because you have a disc bulge doesn't mean that it's going to be symptomatic for the rest of your life. And that shocks people. Like, wait a minute, I can have a disc bulge on an MRI and be pain-free? There's a chance.
Yeah.
You know, but we got to get you moving.
Right.
And so from my standpoint, it's joint motion, muscle, ligament, tendon, complex that I focus on getting moving.
Yeah.
And then what we tell people is, hey, let's sit like this. Let's not move like this. And then last step is, let's go lift some weights. You know,
right.
Resistance training is so important.
Right.
For, you know, bone density as we get older,
mm-hmm.
right?
Or sarcopenia, because a lot of people, as they age, if they don't do anything to maintain their muscle mass, it goes away. Yeah, strength training is the best option for that. And I'm not saying that, you know, I just have a hammer and I see everything as a nail. There are certain things like I had a client come in the other day, and she's got rheumatoid arthritis. And you can see her hands are deformed. And I told her, I said, that's not going to get any better. And there's nothing I can do to make that any better. So I'm not going to sit there and like just hammer away at those joints when I know there's no changing that. But what I did tell her is that we can do everything we can to keep it from getting worse. You know, so again, that it's about that knowledge base and knowing when to push, when not to push, what to address and what not to address. Yeah.
That's a good point.
Yeah.
You know?
So like you said, contact and consult with your medical professionals first, you know, because there's also, like you said, if you got a real hot back that's really flared up, it's recently been insulted, you know, you don't want to go out and start doing like deadlifts or anything like that, you know, because then you're just going to make it worse. You got to wait for that sucker to calm down. So just basically go to a knowledgeable professional to help you work instead of just kind of, well, I'm going to plow through this,
right.
You know, and then you wind up with a permanent injury or orthopedic changes that are permanent.
That's right.
Yeah.
And, you know, and that's why we say 90% is likes extension.
Right.
There's going to be that one person listening right here that's part of that 10% that they're going to go home and do a Cobra and they're going to be like, oh my God, my back is killing me.
Right.
That's the issue, right? And
right.
So we do need to be, just like you write up plans for each individual that comes in here. You know,
right.
You have 3 or 4 people working out in a normal setting, right? I don't know what it is right now with COVID, but and they're all doing different exercises.
Right, because they have different issues, they move differently.
That's right. And that's the same in the way I digest my clients. You know, is you can't just put 4 exercises on a postcard and send it out to everybody.
Right. Yeah, then you wouldn't need a brick and mortar.
Yeah. We just send flyers out monthly, right?
Wouldn't need that manual work.
Yeah.
And real quick before we end, I want to, because a lot of people, I am a big believer in ART, which is active release technique. And a lot of people, when they hear chiropractors, they think, oh, he's a cracker. He's a neck snapper. He's a back popper, you know, and they don't realize that there's other things other than just adjustments. There's also addressing soft tissue issues, right? So you want to talk about those two distinctions?
Yeah, I think chiropractors are notorious for just popping bones, right? And that's what the general public thinks and sees. My philosophy and where I kind of, my knowledge base has come from is the basis of overuse injuries to muscles, ligaments, and tendons, right? And so all those things, they end up inserting on the bone, which move joints, okay? And so, like the shoulder, for example, the best way to phrase it is a lot of people think there was that one instant that just everything went to the shit, right? There's no nice way of saying that.
Right.
They think that there was that one episode, and it's unfortunate because a lot of times they were predisposed just from repetitive motion. And it's not always overuse in here, moving a bunch of weight, right? Overuse can be something as simple as getting up and down from your chair 50 times, and all of a sudden we have a back.
Right.
But so addressing the muscle, as we overuse those muscles, they get bound up, okay? It forms scar tissue or adhesions. And then what happens is we can't contract or relax, right? The muscle should be this filament that slides in and out as it contracts and stretches.
Right.
And when we get bound up in there, we no longer have the ability to move in either direction.
Right.
Okay. And so then it's a matter of figuring out where's the dysfunction, right? Where's the adhesion in the muscle?
Yeah.
Breaking that up to allow for proper flexion or contraction and stretch.
Yeah. Yeah, I agree. What I tell people is that when your muscles contract, I don't know if you can see this, they kind of do that. And when they stretch, they do this. Well, every once in a while, you get those adhesions or those knots. And so instead of doing this, kind of do that, right? Yeah. You can feel like if you sleep on something wrong, like your neck, and all of a sudden it's real stiff. So those are adhesions, right? And there's no amount of stretching that will relieve that. You have to go in there and physically break that adhesion up, right?
Yep.
So that that muscle can go back to its full length. And same thing, each one of your muscles is covered by this membrane called fascia that allows muscles to slide over each other. You can get adhesions and nerve entrapments in there also, and then also cause you to be stuck that you have to break up and to bring that.
And most of the time, that's what we're working on, right?
Okay.
Most of the time, we're working on the fascia that's surrounding the muscles,
Right.
And it's when we get those spots, we've lost all our oxygen, which means we've lost our blood flow, right?
Right.
And so that's why we go in and we break that up. It's going to bombard that area with new blood flow and new pain receptor cells and all these healing properties that we don't need to list out right now.
Right.
But that's what then allows that cycle process. It comes in, we break that up, new things pour in, it gets rid of that scar tissue. Now we're oxygenated again and things can move well.
Yeah.
And
so I'm a big, and that's called active release technique.
And I tell
that's
people
one
it's
philosophy.
A sports version of a massage.
Yeah.
Right? A massage, you usually lay still.
It's a little bit more intensive than a massage.
Sometimes, depends, right? It depends.
Yeah.
Where massage is usually passive, right? You're
Right.
laying there and someone is working on you. But we're using the word active. And so we're taking, that person gets to go through their range of motion.
Right.
And it often is like almost immediate. Hey, I can't reach over my head and touch my opposite shoulder. All right, fine. Let's check out lat, triceps, teres major, minor, all these fancy little muscles. At the end of the session, holy crap, I can touch my shoulder blade.
Right,
You know?
exactly.
It's that quick on a reset.
Yeah, if you can get some of those adhesions or even nerve entrapment, because nerve entrapments can be really painful too. Yeah.
Tunnels.
Yeah. Yeah, so all of that works. And that's a prime example. Like if a client comes in and let's just say they have some restricted range of motion in their leg, right? And I've tried everything. I've tried foam rolling, I've tried stretching, going through a full range of motion, some mobility, stick mobility, all of this stuff. Nothing's working. I'm saying, well, I think you need to go see Dr. Donahue because you might need some ART or something else that I'm not qualified to give you. And then they go and see you. And if that's indeed the case, if they do have some kind of adhesion or bound up, you get that moving again, then they come back and then they can get more out of their
That's
training.
right. That's right. And that's the goal,
Right.
right?
Mhm.
You had the goal in here, and I had the goal with all my patients. It's not how long can I keep this person? It's
Exactly.
how fast can we get them back to doing the things they want to do or love to do.
Right.
You know?
And that's our philosophy here is what we're not necessarily concerned about what you do in here. We're more concerned about how what you do in here affects your ability to do things outside of here. Yeah. All right. Well, Doc, thanks a lot for coming on, taking time, man. I appreciate it.
Absolutely. Thanks for having me, Jim.
So where can people find you? Where's your shop? Where's your website? All that good stuff.
Yep. We have a brick and mortar over in Shrewsbury. So right on the edge, kind of Afton and Webster Groves. Everybody can find me at DonahueChiropracticSTL.com. We're also on Facebook and Instagram under Donahue Chiropractic. So like I've shared with Jim, a lot of people have shown the way for me, so I want to show the way for others. If you have questions, give me a buzz. I would love to answer your questions, and we can address some of those even before coming into the office.
Yeah, awesome. And then those links will be in the show notes on our webpage. Just go to catalyststl.com, click on podcast, and then find Doc's episode, and the links to contact him will be in there. So thanks, Doc. I appreciate it for taking the time, as always. And until next time, be well.